Happy Wisdom Wednesday, everyone. So this week's book of the week talks about artificial intelligence in medicine. It's by Dr. Uli K, Chettipally. And Dr. Chettipally actually came to Potrero Medical, the company that I work for, a few weeks ago and spent time with us and actually did a podcast. I'm going to leave the link to that podcast below. It's a great podcast. You can listen to it on any platform. Definitely check that out. Before I get into the book, though, I just want to give a quick update to you. Those of you who know that I'm currently trying to raise $33,000 in honor of not necessarily my birthday month, but it is because of my birthday and I'm turning 33. I'm trying to raise $33,000 for kids that a nonprofit called Brighter Children's trying to help. Brighter Children looks to raise money and provide books, access to education, basic needs that you and I take for granted growing up here in the States. And it takes these sort of things and gives them to kids in impoverished communities. So for me, I love books. I'm a big supporter of education. And so this nonprofit is something that I really cherish and admire. And so far, first week, not bad. Raised about $2,600. So that's pretty good. And we still have a ways to go to $33,000, but we're still early in the month. But if you like the content that I've created and you've benefited in some way, not asking for $100 or $500, although some people on LinkedIn actually donated upwards of that, so I thank you for that. But skip a latte for a day, $5 would go a long way. So I'll leave the link for that below in the comments. So let's get into the book now. So Dr. Chettipally's thesis in this book, Punish the Machine, is this: that physician burnout is at an all-time high. Physicians are getting burned out. It's more than 50%. But an even bigger thing that not a lot of people talk about is that physician suicide rate is on the rise as well. A lot of physicians are taking their lives. And the reason why is because what they went to medical school for is not something they get to do in real life. They went to medical school so that they can interact with people, to treat and heal their fellow man. And when they go into practice, that's not what they end up doing. More and more of their time is being spent inputting data, interacting with computers and technology, and taking them further away from the bedside of the patient. And so Dr. Chettipally's thesis says that we have access, and especially with AI starting to be rolled out into medicine, we have access to these amazing machines that can do all this work for us. We need to punish the machine and throw all of this work on them so they can do the hard labor, they can do the grunt work and scud work, so that physicians and nurses and healthcare workers can go back to whence they came at the bedside of the patient. And so really, even though this book is a book about technology, it's a book about almost being anti-technology, which is using technology so that we use it less and so we can get back to that human connection. One thing he talks about in the book that I find very interesting, and again, the great thing about this book is that it's a thin book, so it's an easy read, but packed with very high value information, is that for artificial intelligence to really work well, you need an influx of data and a lot of data points, right? And to give you a great example, if you're seeing 1,000 patients with, let's say, an ankle sprain, right? The 1,001 patient you see is more or less going to be treated just like everybody else prior to that, because you don't have the time as a human being to compute all the different data points and to see, oh, there's these different risk factors and these sort of correlations, and so I can adjust my treatment based on this. The other problem is that the institutions or people who do have the time and the resources to study these things are usually these large academic institutions, and by the time they study it, do the experiment, validate it, publish it, it's been 4 or 5 years, and it'll take a few more years for it to be adopted. So the benefit of using AI in real medicine is that these are ways that you can take data points in your own practice, in your own hospital, and start to learn and adopt and adapt and apply new insights based on the populations that you're working with. Now, one thing I want to get a little bit close to you and show you is this fantastic graph, and this will give you a great idea of how AI can work in medicine. So here we have the cost of care on the y-axis going up, and as you go across here on the x-axis, you see you go from different areas of your life, from the community to home to clinic, all the way to the hospital, and it gets more and more expensive as you go down here, especially when you get to complications and death. So the cost of care really goes up as you start going across here, and a lot of times physicians are here. They're not in your home or a community, and so by the time you get to here, they don't know how to best treat you based on these risk factors because you're already here. Now they're just, it's playing reactive medicine, and it's more about disease management versus actual health care. But with the use of AI, which can be implemented back here with all these different data points, prediction and prevention really starts to happen, right? Because now you get focus on risk factors. And so the idea of artificial intelligence in medicine is a great one because, for the first time in history, we have a machine, an intelligent being to help us crunch these numbers, go into things like the electronic health record, which is a wealth of knowledge, and it should be malpractice even not to be utilizing the data that's in there, right? But now we have something that can help us with that. And the most important thing that I love from this book is it talks about the idea that AI is not there to replace healthcare professionals. It's there to augment their skills. And in a way, this is a book about technology, but it's almost the anti-technology book because the idea is you use AI so that it does the grunt work for you. It does these things that physicians shouldn't be spending their time doing, and it allows physicians to free up time so they can spend time doing things that they were trained to do, things that they're great at doing, which is treating the patient directly, going back to the bedside. And so this is really a book not only about technology, but about redemption, about physicians being able to take pride in their work, to not feel overworked and feel like glorified number crunchers, and actually go back to whence they came, which is being healers. So again, fantastic book. I really loved it a lot. Check the comments below or head over to Potrero Medical's page. They will have, I think, a link for the podcast on there. And as always, happy Wisdom Wednesday, and I'll see you next week.